Welcome to the Illuminating Primary Care podcast.
Hello everyone, welcome to today's episode of Illuminating Primary Care. I'm your host today, Ciaran Fletcher, and today I am joined by a GP who is very active on social media, a gentleman who's been a doctor since 1989, a GP since 1993, has been a partner back in 95 and became a GP trainer in 2000. This chap has also been involved in training 60 GPs and has worked approximately 140,000 consultations. And that guest is Dr. Steve Taylor. Steve, thank you for joining me today.
Hi, good to see you.
Could you give our listeners a little bit of background about yourself, besides the impressive CV I've just read out for you?
Yeah, so I'm a father. I've got three daughters. I live in Manchester. So my daughter's 20s, so 26, 24, and I've got an 18-year-old, just finished their A-levels, about to enter university. They've all done various different science jobs, but not medicine. I haven't persuaded any of them to be doctors. So chemistry, physics, and maths is the little order of what they've done. So
wow.
Yeah. And my wife's a teacher, so she's a primary school teacher.
Excellent. Okay. And could you give our listeners a little bit of background about your work and that side of things and kind of why you became a GP?
Yeah, so as you said in the beginning, I studied medicine in Manchester, came up in 1984, did my undergraduate training here, and then initially I was looking to become a paediatrician. So I started down the paediatric route and did a couple of years of paediatrics. But I suddenly realised that actually all the paediatricians didn't actually spend very much time with patients. They were either doing ward rounds and just letting everyone else do the work, or outpatients was fine. But I thought, actually, do you know what? I love being with people. So and it dawned on me fairly early on that general practice might be the place where I should go. So I changed tack probably 2 years after that. And back in those days, you could self-construct a GP program.
Right.
So I did some obs and gynae and then straight into general practice, 1983. Yeah.
Excellent, fantastic. Now, for any of our listeners who are not aware of who Steve is, I came across Steve on LinkedIn because you're quite active at posting various articles on there.
Sure.
And what's really refreshing to see is that what you are posting is very much flying the flag for GPs and in defence of GPs, especially when they're getting criticism in the mainstream media. So in terms of that side of things and what you are sharing, the facts around GP workload and NHS pressures and things like that, where did that come from? Why did that start, Steve?
Yeah, so I just to sort of heads up, I was a partner. I gave up my partnership 2 years ago. But sort of prior to that, I'd started to look at some of the facts around general practice. And I've been a sort of hardworking, I was a very hardworking GP for 27 years and a trainer. But I suddenly was really surprised at some of the things I just didn't know. I mean, so for example, I didn't know that the average day, 1.3 million people have consultations in general practice, and that only 67,000 people go to A&E. And I was just, it just sort of blew me away, really. Because if you read the newspapers or looked at the media, you'd assume that A&E would be massively, equal almost in terms of numbers. But 67,000 compared with 1.3 million was just a massive thing. And it got me looking. I started looking at facts. I looked at figures. I actually realised that even if you combine all of the work done in hospitals in terms of patient interactions in a day, it didn't touch general practice. And I think I realised then that actually GPs were doing a lot of work. I mean, a lot more work than I'd even imagined. And given that I've been a GP for 30 years and I didn't know this, I thought, well, I'll tell you what, I'll start sharing some of these facts in some of these online forums. So I actually started with, there's a couple of big Facebook groups, GP Survival and Resilient GP, which says something about where GPs are at with the names of those two groups. So GP Survival's got something like 10,000 members and Resilient GP has got just over 20,000. Wow. And I started sharing some of the facts there and I was getting a lot of positive feedback and I thought, this is great, actually. And so I started reading more details and sharing more. And probably about 2 years ago, I thought, well, I've got a Twitter account, so maybe I'll resurrect it. I mean, I'd only ever used Twitter to complain about my hire car company or the fact that the British Airways had lost my luggage. And on both occasions, it was really helpful and really successful. I got my luggage back, and I also got my and the hire car company sorted out my hire car, so it was brilliant. But I thought I'd start using my Twitter account. I started sharing the facts there, and I suddenly started links with various different doctors and media influencers, and actually over the last 2 years, what's happened is that I've developed a bit of a following on Twitter, which is now X.
Yes.
I have got known for the guy to come to work out all the numbers and the figures. So if somebody goes on telly, often some of those people have spoken to me first.
Okay.
Which is a surprise because I wasn't that doctor. I wasn't high profile. I was just a bog standard, get on with it GP. But to be honest, I think probably because I've trained 60 trainees, not all at once, I hasten to add, but over a number of years, I really wanted to make sure that we've got a GP service that's there for everyone else, and everyone that's worked in general practice over the last 13 or 14 years knows it's been increasingly difficult, and I do remember when it was actually quite good to be a GP, and pretty well resourced, and the numbers of GPs were going up, which bizarrely enough was only 14 years ago. So numbers were rising, money was okay, things were doing okay. I can't think what might have happened 14 years ago, but things have changed, and it's become increasingly hard for GPs. And I appreciate, a number of the listeners will recognise the challenges in terms of workload over that period. So yeah, that's sort of how I got into it, how I started sharing stats. I've read more reports than I care to imagine.
Yeah. But it's
yeah.
needed in terms of what you are putting out there for people to look at. And I mean, I noticed on your LinkedIn profile recently. You'll have to forgive me. I can't remember the chap's name, but there was a GP who'd been on. Was it Good Morning Britain?
Yeah.
And I presume by what you've said, did he speak to you first before?
Yeah, not always, but certainly a few have. And actually, I've had a few TV interviews recently as well. So I've been on Sky and I've been on BBC and
Excellent.
LBC. I think for me at the moment, it's trying to cut through the noise of negativity around general practice, and really making sure that people generally are aware of what GPs are doing. How hard they're working, and the media has not been helpful in this, and frankly the government haven't been great either. Although I think some of that's changing. I mean, I think even in the last few months, Sky did an incredibly good analysis of general practice just a couple of months back, with some really good information being shared. The Financial Times have done some good articles, and the Times as well. So I think gradually. The information is getting out there that actually, one, that GPs are struggling, two, that there are fewer of us.
Yeah. Well, just for our listeners' sake, before we started recording the podcast today, Steve and I discussed a couple of topics that we wanted to bring up that we think would be most beneficial for our listeners. And one of the points that you'd mentioned to me, Steve, was to talk about the increase in workload for GPs and the falling numbers of GPs.
Sure.
So I know you've mentioned, since 2014, 14 years ago rather, there's been this significant change.
Sure.
So what is it that you think has brought about this increase in workload? Is it purely the decreasing numbers of GPs, or is it more and more, higher population numbers? Is it GPs retiring earlier?
It's interesting. I mean, again, these are facts, but I've looked at a lot of this. So you'd assume that actually a lot more GPs were retiring, but the actual retirement rates have been fairly static. So something like 10% of people are retiring every year, and that hasn't changed. So what's more worrying is the younger GPs are leaving. So they finishing training and going. So if you look at the something like 25% of under 30-year-olds have left after completing CCT,
Right.
which is quite a big number. 1 in 5 are just sort of now they may be going to Australia or Qatar or Canada or somewhere
Yeah.
more pleasant and better paid. So pay is part of it. What's creating the extra workload? I mean, I mean, some of it is just the fact that we're much better at looking after people. So people are getting older. I did some work on this probably a couple of years ago, and when I started, something like 20%, 1 in 5 people were on some sort of medication. It may not surprise anyone listening to know that it's now 1 in 2. So 50% of the population are taking some sort of medication,
Right.
which now you're going to say, what is that sort of medication? Well, it's things like cholesterol medication or blood pressure medication. It's things that are preventative, things that are going to keep us well. But that means that all of those people that historically wouldn't necessarily have needed a review once a year are now getting reviews at least once a year for their blood pressure and their cholesterol medication. Now that's great news. We're keeping people alive longer. So there is that. So there's the fact that more people are on medication. I think there is the issue around that we're getting an older population. So people are getting older. I mean, the population's grown as well. So since 2015, there's 7% more people in the country. So the population's grown in that time. So we've seen a 7% reduction in numbers of GPs. So there's 2,000 less GPs now than there were in 2015, but there is a 7% rise in the number of people. Plus, people are taking more medications. We're keeping people alive longer. So if you add those two together, just the 7% rise and the 7% decrease, there's 15% more work.
Yeah.
And then if you throw the pandemic in, there is now, as is well noted, over 7 million people waiting for operations. So, not operations, but waiting for an outpatient or a hospital treatment. But if you do the numbers on that, that's 1 in 10. So 1 in 10 of the population are now waiting, and they're not waiting at home twiddling their thumbs. They're waiting by coming to see GPs and saying, well, I've got pain in my knee still. I'm waiting for a knee replacement. Can you give me some medication? I've got a hip problem. All of those things. Yeah.
Yeah. I think going off what you've mentioned as well, this came to mind when you mentioned the medication. I would imagine, and you may be able to correct me on this, Steve, if I'm wrong, but I would imagine that since mental health has become, let's say, more in the public eye, and
Sure.
people are starting to realize and go and have these things checked out, and whether it's depression, anxiety, whatever that may be, there's more and more medication and drugs that are available to help cope with that as well. Whereas, perhaps 14 years ago or longer, or maybe even not that long ago, there wasn't that as readily available.
I think, I mean, mental health's a big issue. I mean, it's a good thing that we're now recognising that people do have issues with mental health, and it's great that people come forward. Most GPs will recognise that somewhere between 20 and 30% of their workload is mental health related.
Yeah.
Or has an impact on other aspects of their care. So if you've got a physical health issue, you may well have a mental health issue running alongside it, just because it's difficult and emotionally difficult. You're right about medication too. I think we've got medication, and sadly, we've got very poor mental health services in the UK. So, it's just been exacerbated by the pandemic. In that, I was talking to my colleagues. We work in Bury, actually, North Manchester. The waiting times for mental health services is just appalling, really, and difficult, and CAMS and other things it's really hard. And it's not just general practice that's been suffering. I mean, this will also be, the other allied services around general practice have been struggling as well.
Yes. I noticed your recent post about that. Was it this morning? Or yesterday? And you talked about the different levels of funding.
Sure.
And I think it was it social care? There's only £901 million put into that, whereas other areas there's billions of pounds going in. So the funding side of it and the support around primary care, there needs to be more. And like you mentioned in your post itself, Steve, about there needs to be more funding put into both primary care and social care in order to help those areas stay alive, basically.
Yeah, and I think even if there was no extra funding into general practice, I mean, I think there should be, but if the money went into social care and community care in terms of district nursing and other things, it would make life for general practices a lot more viable. I mean, just another number that's just out of the air. There are 42% less district nurses than there were 10 years ago as well.
42%.
Yes, massive drop. Yeah,
Wow.
I mean, just imagine how much better community care would be as well if we had all those district nurses back on the.
Gosh, that's a
I mean,
startling statistic.
It's a huge statistic, isn't it? Yeah. So nearly half the less. And as a GP that's been around for that long, I do remember how good it was to have a lot of district nurses around. And I really feel for them because we're trying to give them work, and they're saying we haven't got capacity. They're bouncing the capacity back to GPs. GPs saying we can't do this, and everyone gets grumpy with each other, and it's a very unpleasant place.
Yeah, and just going off what you mentioned about near at the beginning of what you've mentioned, with regards to junior doctors and younger GPs and newly qualified GPs leaving, what do you think has been kind of the primary catalyst for that? Because, do you think it has been the pandemic and there's too much mental health for them to deal with and they're maybe not properly prepared for that? Or do you think there's other factors that are leaving people to, like you mentioned earlier about Australia and Qatar, is it things like that where people have these opportunities to go abroad and earn more money?
Well, I've lost a partner to Qatar. So she gazumped me. Actually, she left the practice before I did. I was going to leave, and then I ended up staying around another year and the pandemic as well, because she left, and so she's gone to Qatar. I've had trainees move to Canada and New Zealand and Australia. So there is a bit of that going on. I think some are recognising that actually portfolio careers are different, so they can do slightly different things. So we're talking full-time equivalent numbers here. So some GPs may be doing other things as well. Some are going back into hospital medicine and working for urgent treatment centres and other things. And some are just deciding that medicine isn't for them, which is really sad. I mean, I think fortunately 80% are sticking around. And that's partly why I'm here to bring a bit of hope, actually, because I think general practice is still a great job and I love it. So even though I, semi-retired 2 years ago, I'm back in working as a locum and loving being a doctor. I think that anyway. So why are they going? I think it's multifactorial, isn't it? I think it'd be great to do a bit more of a survey of that. But the other thing is that there are a lot of overseas graduates now working in the NHS, which is really good. And frankly, we couldn't survive in the NHS without overseas graduates. So in an average year, 7,500 medical graduates come out of med school. But we need 15,000 doctors in the country. So actually, last year, 13,000 came from overseas, joined the medical workforce in the UK.
Right.
Now, many of them find their way back into general practice, and their ties to the UK aren't the same as my ties to the UK. Their parents don't live here. And so what used to be a destination for some overseas doctors, we used to come here, live, work, and stay, has become a place where people come, qualify, stay for a bit, and then move on. So I think there is an element of the UK becoming a stopover, whereas it used to be a destination for medical professionals.
Yeah,
and I think we got to be real to that. There's a shortage of healthcare workers throughout the world, and you as a recruitment agency will probably know that as well. That you see, the numbers of people that are looking for certain jobs and probably see the difference in terms of what people are looking for in terms of career as well.
Yeah, and just going off what you've mentioned there, Steve, I mean, in terms of the work that we do, I know it's not just myself with this, my colleagues as well, the amount of practices we're having to kind of urge to offer tier 2 visa sponsorship and have these GPs from overseas, who've qualified in the UK but come and work in their practices. In some circumstances, especially in your more remote areas, it's desperately needed because there's no kind of, for want of a better expression, British GPs who are prepared to work in that area, because I think a lot of the time now they know that there is a massive demand of GPs and there's loads of vacancies, but there's not many GPs. So
Sure.
sometimes I feel that they try and play the field a little bit, if you will. But with
Yeah.
the GPs from overseas who require the sponsorship, sometimes you are getting a damn hard working GP.
Oh yeah, 100%. Yeah.
And it's important that these practices don't miss out on that.
Yeah.
So it's interesting to hear your stats on that.
Yeah, and a lot of my trainees have been overseas graduates, and I love them. And one of my most recent ones was he grew up through the Iraq War and was drafted in as a soldier, and he only qualified as a GP here in this country at the age of 60.
Wow.
Lost 20 years of his life in Iraq, but he's here to work, and he's one of the most hardworking trainees I've had, and he's anticipating. He's older than me, and I was training him, but he's anticipating working for another 10 or 15 years in this country.
Good.
All those years he'd lost from being sort of
From the war.
drafted in. Yeah, exactly. Yeah.
Well, talking of statistics and things like that, I've noticed that you'd posted recently some findings from the International Health Policy, and there were some really shocking statistics in there, particularly about the UK. So, for instance, one of them was when asked about income satisfaction. Of the countries that were asked, the UK was the second lowest, with only 23% satisfaction. In terms of whether or not there was satisfaction with medical practices, the UK was the lowest of all the countries asked, with 31% satisfaction. And in terms of the daily workload, the UK was by far the lowest, with only 4% satisfaction. So it's interesting hearing you talk about, what your experience has been, and then seeing the statistics like this. You can almost understand why GPs are leaving if there is that workload dissatisfaction. But what do you think needs to be done to kind of turn that these sorts of statistics around, Steve?
Yeah, I mean, I sort of hinted at it when I mentioned before. I mean, it's not that long ago that general practice was doing fine. So, I mean, some of it is financial. We can't get away from that. That there's been a big drop in income for doctors in the UK. Something like 25 to 30% drop in income.
Wow.
Since 2008. Which was 2005, 2008, which was the peak. And it's been dropping gradually since then. And then practices generally have been are not having as much resources put their way. They're going to PCNs and ICBs, so it's not actually direct finances to GP. So I think one of the things that needs to happen is that the GP contract needs to be much more focused around GP practices, and the funding formula needs to change. So I think that's one thing that needs to happen. I mean, I think, as I've alluded to, I think improving some of the support services around general practice is key. Yeah. So whether it's be district nurses, social care, mental health services. So it does. I mean, all of those things work together. In terms of GPs themselves, I mean, one of the things my very last day as working as a partner, I dealt with, I think it was 60 one-to-one consultations that day. That was my last day as a partner. And it sort of dawned on me that had crept up on me over a period of years. So if I go back, 30 years when I started, I do 26 consultations a day and probably 3 phone calls. 10 years later, it was 26 consultations and 6 phone calls and a couple of home visits. Another 10 years, and it was 27 consultations and 15 phone calls. And then by the time I left, it was so a bit like the boiling frog in a pan. I'd got gradually hotter and hotter, and hadn't realised just how difficult it was. And so when I left, actually, the partners that I left behind, which were, to some extent, I was protecting, I was covering it. And one of the reasons I was doing so much extra work was to make their lives a bit easier. They ended up restricting the number of consultations they do to 35 a day, which is still too many according to the BMA. The BMA reckons 25 is a sort of safe number, but 35 is a lot better than 60 or 50 or 40. So I think one of the things that has to happen is some sort of recognition that there is a safe working limit for doctors, and and a bit like airline pilots or HGV drivers or whatever, that there has to be some sort of limit in terms of numbers of consultations you can do in a day. Now, in order to make that happen, you also have to let the public know that there's a limit to the number of consultations that they can have as well. So we need to somehow do a joint education program around what's safe for doctors, but actually what's appropriate for patients. Now, I don't want to blame patients because, ultimately they do and want to see doctors, but and we've had an increased number of allied healthcare professionals come into practice in part to mitigate the loss of GPs. Now, the problem is that that's been funded and pushed by NHS England without really supporting GPs themselves. So I think we need to sort of look at how you support GPs. So we've talked about workload, we've talked about some degree of funding, we've talked about support outside of general practice, and I think probably on top of all of that, it's a sort of joint media campaign, NHS England, government agreeing, let's support our GPs, let's make their lives easier, let's not scapegoat them from a contract from 2005 where apparently they earned too much money, and this sort of and there was a truth in 2005 when GPs suddenly had a massive increase in income, but it's been taken all back, and I think it is a case of just sort of saying, well, actually we ought to pay the doctors that we need in this country to stay in this country.
Yes.
And in order to do that, we need to pay them a fair pay, and that is more than the average wage. It isn't. GPs are very well rewarded for what they do, but actually at the moment, because of the extra work and the pressures that are under, I don't think most doctors feel it's viable to stay within the amount of work they're doing for the pay that they're doing. So a number of things.
Yeah, you mentioned one thing there about getting something that would be government backed to, I think, put the word out there to support GPs more and what needs to be done in order to support GPs. And one of the topics that you'd mentioned to me prior to recording was the failure to support GPs since 2010 by the Conservative Party and NHS England. Could you just tell me a little bit more about that and talk to our listeners about what your thoughts are there?
Yeah, it's interesting, isn't it? We've had 5 health secretaries now. Is it 5 since 2010? Jeremy Hunt Jeremy Hunt was there the longest. But in 2015, Jeremy Hunt, as part of the sort of pressure manifesto at that time, suggested that we needed 5,000 more GPs in this country. That was 2015.
Okay.
We now sit at 2,000 less than that number, so 7,000 down compared with what Jeremy Hunt asked for at that point. So they did know that there was a problem back in 2015, but they've done nothing to sort of mitigate that. So they gradually cut funding. They've gradually, talked about needing to see GPs on the day. They've talked about, there's been a lot of media pressure to do certain things without understanding what the issues are. 2019, Matt Hancock on their manifesto said that they needed 6,000 more GPs. So they've gone from 5 to 6,000. And even on that number, we're 1,000 down. So that's what I mean by they say one thing and then suggest another. More recently, there's been this sort of end the 8 a.m. rush for GPs, which has been the sort of Tory. So they've invested 250 million quid in telephone set, phone number, electronic digital phone lines. I did a little survey to find out how many GPs had already got digital phone lines in place, and it was something like 70% had already got them.
Really?
Yeah. So this was, it's smoke in the wind, isn't it? But actually, if you ring a doctor and there's only one doctor there, and they've only got a limited number of consultations, it doesn't matter how quickly you get through on the phone. There's only that many appointments.
Yeah.
So I think probably some sort of recognition from government. NHS England, I don't think has really been particularly supportive of general practice in terms of the way that they've done things. Certainly the contract hasn't helped. and the current GP contract, which has been running for the last 4.5 years, hasn't changed, despite the fact that we've got 10% extra inflation, or 17% over that period. But and there's been no extra funding put into GPs to help survive. Now GPs have got to, we're small businesses, and there's a lot of people, probably rightly point out that GPs are in some ways private providers. I mean, they are independent contractors, but we've got nowhere else to contract. So it's a bit of a funny thing. And I always like to think of GPs being a little bit like the CEO of Tesco's, who's also a checkout worker. So, we're not just the CEO, we're also the person that's on the till and talking to the punters. So there are very few CEOs of Tesco's that work on the tills as well. Whereas GPs are actually providing the work. Whereas most private providers, you've got shareholders and other things working behind the scenes. So that's government in terms of them. And media, I really don't know why media have been so negative about GPs. I mean, since 2019, in 2020, when the pandemic hit, GPs provided 70% of all the vaccines. And they did it at less cost than all of those major vaccine centres that were put in place. It was £5 or £10 cheaper to get a vaccine at a GP surgery. So they've done all that extra work, and then since 2019, the actual volume of appointments has gone up 20%. So GP practices are providing 20% more appointments than they were in 2019. In fact, it's the only area of the NHS that's, apart from cancer care, that's doing more than it was in 2019. All the other areas of hospital, A&E, are doing about the same as they were in 2019, but GPs have gone up. And I don't know quite why we're not celebrating that. Instead of criticising GPs for being, lazy or failing to see people face to face again.
Which is the sense that bad news sells, and the media think, well, if we report good things that are going on in the world and in primary care specifically, we're not going to sell papers, people aren't going to click the links to read our articles. So they think, right, if we're negative and we criticise, which I think everybody can agree the mainstream media is very guilty of.
Yeah.
Do you think that could potentially be what's happening?
Yeah. I mean, that's probably true. I mean, I think the other thing, of course, is that we all, 30 million people a month go to a GP surgery. So that's half the population. So everyone's got a story about a GP surgery, whereas actually during the course of a month, only 2 million people go to A&E. So there's going to be less of them with a story. So I think, I mean, it is volume of, that's why we've got bad stories of receptionists who, the sort of dragons on the desk who keep you away from GPs. I mean, that's going to be replaced by, the dreaded phone, on number 30 in the queue. Because it's now a digital phone line and you're number 30, so you're going to blame the digital phone line for being in a hold. But I think you're probably right. I think it's the popularity, the number of people are seeing GP practices. It's not just GPs; it's GP, it's nurses, it's pharmacists, it's healthcare workers, and it's physios and other people that work within general practice surgeries. But so everyone's got a story. So I think in some ways, it's not surprising that you get a lot of stories in the newspaper as a result of that. Because if 30 million people get an appointment in a GP surgery a month, there's probably 4 or 5 million people that didn't, who wanted one. So it's not very hard to find 5 or 6 people who want to whinge to the newspapers. It's fairly easy, isn't it?
Yeah, and it's similar with Google reviews. You can look at GP surgeries and they can have, really low reviews, but they might only have less than 10 reviews in some circumstances.
Sure.
And you can tell, and when you actually read them, what people have written, it might be too long on hold, or, things like that.
Sure.
That aren't really worth going on Google to leave a negative review for, in my opinion.
No, I agree. I mean, patient satisfaction surveys are still pretty good for GPs.
Absolutely.
They're most, in our practice, 90% of people are happy with the consultation they receive, or 95%. 80% are happy with the service they're getting provided. The the truth, of course, is that once you get through the door and see a GP or a nurse or a pharmacist, you're generally very happy, and it's a good service. 5-star reviews or 4.5-star reviews. Sadly, that number's falling partly because of the demand. If you've got extra demand and fewer doctors, your star reviews are going to fall, isn't it? It's a bit like trying to get a hotel bed at Premier Inn, and they've reduced the number of beds. You're not going to get a bed, are you? So you're going to be grumpy with Premier Inn for not having enough beds available.
It makes sense completely. And just going back to what we were talking about, keeping on the note of politics, when we discussed the Tories, the Conservative Party, do you feel that in terms of especially what Labour are saying at the moment in the press about scrapping partnerships, abolishing them, and changing the outlay of primary care, do you think there's perhaps a lack of understanding by Labour and the Lib Dems, arguably?
Yeah, 100%.
Yeah. Okay.
So, I got in trouble with Wes Streeting 2 days ago, and he commented on one of my tweets, and I told him he didn't understand what was going on in general practice, and he told me to read the whole article, which I had. Anyway, so I'm not particularly party political in that sense. I generally want a really good general practice for the population. I think as GPs we all want a good service. Scrapping partnerships is not a great idea when partnerships are struggling. So if you've got a business model where 67% of all doctors, all GPs are partners, and if you tell them that their model of business won't survive the next government, that's not going to be very good for your business model, is it? No. If you knew that the next government are going to remove your business within 4 or 5 years of the next government, it doesn't promote good well-being, and it doesn't promote your investment in your business, does it? So, and I've got to say, even as a partner, as I've left my partnership, but we've struggled a little bit to get people to buy into our partnership because they're slightly cautious and worried about what Labour might do. So that was the partnership one. I think it was short-sighted. I think it failed to understand what partners provide.
Absolutely.
Generally, and actually that you get more value for money out of partnerships than you would out of a salaried workforce, potentially. That isn't to decry our salaried workforce, because I think they do an amazing job, most of them, and do over and beyond what they're actually paid to do. But partners probably do more than that. They do over and above plus a little bit. Most partners are working many more hours than most people are aware of. So I think that was the thing. The bit I got in trouble for Wes was that he was trying to encourage people. He was advocating paying for continuity of care. So rewarding practices that have got a good score on continuity of care, and those that didn't will get less money. Now, on the face of it, it's not a bad idea because we believe in continuity of care of GPs. But the problem is that it actually undermines all those places that have got one GP per 3,000, which tends to be the poorer areas. It tends to be the remote areas. And actually, it's very hard to have continuity of care if you're a training practice. I was one of the popular doctors in my surgery. Everyone wanted to choose me and my other partner, and they didn't really want to see the trainees. So so that was again another reason to sort of highlight that as an issue. And their slogan is, "We want to bring back the family doctor." I think my slogan back to Labour is, "We haven't gone anywhere. We're still here." And all we need is a bit of support, and we'll still provide. Like we did the COVID vaccines. So that's Labour. Lib Dems, they've probably got a little bit less skin in the game in terms of sharing stuff, but I think their slogan was we were going to guarantee access to GPs within a week, or it might even be shorter than that. The problem with that, of course, is that some people want to book their GP a month ahead, and actually have it in the diary. I've got to say, it's very hard as a patient. I sort of joked about I was number 31 in the queue for my own GP a few weeks ago, and it's not easy. I did get through eventually number 31. I did get an appointment actually that day. People forget that doctors are also patients.
Yes.
they forget that doctors are also punters and go to hospital and need appointments and all the other things. It's not like we don't understand the needs of patients. Patients aren't the enemies. We're all in it together.
Yeah.
And I think perhaps I don't really think that Labour. I don't think any of the MPs are particularly listening well to some of the sort of more knowledgeable members of general practice. I think they're sort of caught between a rock and a hard place. If I'm going to be kind to, let's just say, kind to Labour and kind to the opposition parties, that they have to sort of say things that might appeal to people.
Yeah.
So we bring back the family doctor. We guarantee an appointment within a week. They all sound really good. We're going to pay for continuity of care. They're positive things, and I suppose in some ways the fact that they recognise that is a good thing. Labour's other thing is, and the Conservatives have done the same, and Liberal Democrats have talked about increasing medical school places, which I think is a good thing. But as I described before, with 1 in 5 under 30 GPs leaving, that actually retention is probably more important than retaining. So retaining is more important than training. And if we could retain those that we've got, then I think we're in a much better position than we would be training people. If you look at training numbers in general practice have gone up and up and up over the last 10 years. Yet the outcome of that increased training has been a drop in numbers of GPs.
Yeah.
So the maths doesn't quite add up, does it?
No. I think just going off what you've mentioned about Labour, having these slogans and saying these things to try and stand out a little bit. I suppose it's just like the Tories saying we want 6,000 more GPs. But the question is, how are you going to do it?
Yeah, exactly.
It's all well and good saying this is what we're going to do. I remember it when, not to get too off the political bandwagon, but when Jeremy Corbyn, when he was running and he was saying we're going to abolish student fees. Well, how? How are you going to do it? And it was never explained, and it never happened. So
Sure.
I think in the case of primary care, it's that, and it's thanks to people like yourself, Steve, who are asking the questions and putting the facts and the stats out there, that helping people realise this is the actual lay of the land in primary care, not what the mainstream media is necessarily telling you, but this is evidence-backed, factual information. And I think a point to bring us towards the end of this podcast and this episode, Steve, is hope.
Yes.
Do you still believe that there is, for want of a better expression, let's say hope for primary care?
Yeah, I do. I wouldn't have been a GP 30 years, and I actually love the job. I think it's a great job. It's such a privilege.
The vocation.
It's such a privilege to be part of people's lives. And even now as I go back, I locum in the practice that I was a partner in, and I've become their perfect locum because I just cover every holiday. The satisfaction people get from it's great to see you and that sort of thing. It's just a joy. There is joy in that job, and I think most doctors recognise the joy in the work, and the challenge as well. I think there's significant challenge in diagnosing somebody correctly and getting the right and getting the job done well. So there's hope in that. I think there's hope in the fact that people are still applying to medical school. That medical schools are oversubscribed 3 to 1 every year still. I think there's hope in the fact that people want to be GPs and the training numbers are up. I think that's hopeful. So therefore, I'm probably hopeful that you could turn it around with a bit of the same impetus that came in the sort of early noughties, between 97 and 2004, where there was money put into general practice, and the reverse in retention did change. There were some mistakes made, and for a brief period in time, GPs were probably paid a bit too much. I was one of the good recipients of that particular thing. You could argue we're just receiving money we didn't have from the previous 10 years, but I think because I've seen it happen once, I'm fairly convinced it can happen again. But I think what it doesn't need is revolution. It doesn't need the end of partnerships. It needs working with partnerships. It does need allied healthcare professionals working with GPs, so the pharmacists, the physios, but it needs more GPs. And I think the other thing is, that although there's been 2,000 less GPs since 2015, there's been 29,000 more doctors added to the health service.
Okay.
So in hospital, there's been that many. So there are doctors in and around the NHS, and I think we just need to change the atmosphere. And funding probably does need to change. One of my favourite little memes I've done is that we spend less on GPs in the UK than we do on our haircuts. So the average spend in the UK is for a year is about 180 quid for haircuts. But sort of over the course of 12 months, we might spend that much money on our hair. In the UK, we only spend £165 a year on general practice. So 45p a day, which isn't a huge amount. Which isn't a huge amount of money for an all you can eat service.
Yeah, and that's really quite eye-opening when you think of it as 45 pence per day. It doesn't sound, when you say it like that, it doesn't sound enough, does it?
No, and it's less than a. I mean, we spend more on our cars and our pets, don't we? But I think if we really, it wouldn't cost an awful lot to improve GP services. So an extra £20 a day per person per year would probably be enough to turn it around. Which doesn't, on the face of it, doesn't sound. It's 3 cups of coffee at Costa, isn't it, or whatever. It's not a huge amount of money, and yet it still is 1.2 billion quid. So when you wind it all out, it's still quite a lot of money. But anyway. Excellent. So there is hope. I'm hopeful because people still want to be GPs. I'm hopeful because actually most people, 9 out of 10 people like their GPs when they go. I'm hopeful because the job is a great job. And I'm hopeful because it's been turned around once before. But it does need a political change.
It just sounds like it really needs, on the political side of things, it needs somebody to really. And I appreciate that any politician you bring this up with would say that this is what they are doing, but it needs them to have their eyes opened and listen to somebody like yourself and talk about the facts and the figures and the stats, really get an understanding as to things, and then seriously implement a plan as to how these changes can come into play.
Sure.
Because like I say, it's all well and good saying we're going to get 6,000 more GPs or we're going to bring back the family doctor and scrap partnerships, but how are you going to do it? And, I think, as a wise man once said, experience outranks everything. So from speaking to people like yourself, that's who the politicians need to be speaking to, instead of just looking at this like a playbook and, reading information in a binder. They need to be talking to people who've been there, boots on the ground, seeing patients, dealing with telephone calls, doing home visits to really understand these things. But unfortunately, sometimes I feel like I'm asking for too much with that, despite it sounding like the most commonsensical thing to do.
Well, maybe we'll get a few more people to listen to this podcast. Might help. So,
Yes. Well, speaking of, where can our listeners find you on social media and connect with you? I know, obviously, you mentioned you're on Twitter, but what's your @ handle?
Yeah, so it's Dr. Steve Taylor.
Dr. Steve Taylor.
So fairly simple. So at Dr. Steve Taylor, so that's X, isn't it, on Twitter?
X now, yeah.
Yeah, you'll find me there most days, spouting something about the NHS or GPs. I have set up a Facebook page called NHS Facts and Stats, and I post quite a lot of my information there as well. So that's NHS Facts and Stats on Facebook. And I have, as you discovered me on LinkedIn, I've started probably once or twice a week putting something on LinkedIn as well. But that's that was just me thinking I need to reach a different audience, and LinkedIn is a very different audience from Twitter and Facebook.
Excellent. Well, listen, thank you so much for your time. It's been a pleasure to have that conversation with you and talk through that.
It's been great.
Those topics, and we'll certainly be doing what we can to kind of share this and spread it across the internet so that people can have a listen and try and understand what the lay of the land is.
Great. Well, thanks for having me.